Today, we're talking about a medication you might know by its brand name, Ativan. The generic name is Lorazepam, and it's a drug with a really starkly dual nature. For some people, it is an absolute lifeline in a moment of crisis, but for others, it can become a really dangerous path toward dependence. So we're going to explore both sides of this powerful medication. And that really gets to the heart of the matter, doesn't it? Is this just a simple prescription for calm? Or is it a potential gateway to dependency? Well, the truth is, it's both. And understanding that very delicate balance is absolutely crucial. So let's start by digging into what this drug actually is. All right, first up, let's get down to the basics. What exactly is lorazepam? Well, at its core, it's what's known as a central nervous system depressant. So lorazepam is part of this family of drugs called benzodiazepines, and its main job is to act as a central nervous system depressant. Now, that term might sound a little intense, but all it really means is that the drug is designed to slow down the electrical activity happening in your brain. And that one simple action, well, that's the source of both its biggest benefits and its most serious risks. Okay, so how does it actually manage to slow the brain down? To get that, we need to look at how lorazepam basically acts like the brain's brake pedal. To really understand lorazepam, you first have to know about a little something called GABA. Simply put, GABA is your brain's natural brake pedal. It's an inhibitory neurotransmitter, which is just a fancy way of saying its job is to tell your brain cells, hey, calm down, stop firing so fast. When GABA's doing its thing, you feel relaxed. You can think of it as your brain's built-in off switch. But here's the really fascinating part. Lorazepam doesn't actually create some new calming effect out of thin air. Instead, it works with what's already there. It finds your brain's GABA receptors and just makes them, well, hyper-efficient. Think of it like this. It's not pressing the brake pedal for you. It's more like it's supercharging your brakes, making your brain's own natural calming system way more powerful than it normally is. So what you get is this simple but really powerful chain reaction. First, lorazepam boosts GABA. That, in turn, slows down your neurons. And that leads to this widespread reduction in brain activity. This is what creates those intended effects we're looking for, a feeling of calm, relaxed muscles, and sedation. So now that we know how it works, let's talk about why it's used. And this brings us to the benefits, where lorazepam is really an essential tool for dealing with a crisis. The approved uses are very, very specific, and in a lot of cases, they're life-saving. We're talking about giving short-term relief from severe anxiety, stopping an active seizure, which is basically an electrical storm raging in the brain, or sedating a patient before surgery. Now, the key phrase to remember through all of this is short-term. This is a drug for acute situations, not for chronic day-to-day management. And you know, the way it's given also kind of tells the story of its purpose. For general anxiety, a standard oral tablet works fine, taking about 30 to 60 minutes. But in an emergency, like a severe panic attack or a seizure in a hospital setting, it can be given under the tongue or as an injection for an almost immediate effect. The form is always matched to how urgent the situation is. But with a drug this powerful, the benefits are really only half the story. Now we have to flip the coin over and look at the other side, the risks. You could call it the high cost of this medically induced calm. You know, a lot of the common side effects are really just an extension of what the drug is supposed to do. Drowsiness, sedation, feeling weak or unsteady, all these things happen because the brain is being deliberately slowed down. And while that's the intention, these effects can seriously get in the way of you functioning safely in your daily life. And this is where the danger of long-term use really starts to become clear. It's kind of this four-step path that starts out with normal, prescribed use. But if you keep taking it, your body can build a tolerance, meaning you need more and more of the drug to get that same effect. This can lead to physical dependence, where your body's chemistry actually changes and now needs the drug just to feel normal. And from there, if you try to stop suddenly, you can trigger withdrawal, which can be a brutal and frankly dangerous experience. And withdrawal isn't just unpleasant, it can be incredibly dangerous. It often involves this rebound effect, where the original anxiety or insomnia comes roaring back, sometimes even worse than it was before. In severe cases, it can even lead to life-threatening symptoms like seizures. So the bottom line is this. This is not a medication you can just decide to stop taking on your own. Now, we have to talk about drug interactions. Lorazepam carries an FDA black box warning that's the most serious kind they have. And I'm just going to read this directly from the source. Combining benzodiazepines with opioids creates a high risk of profound sedation, respiratory depression, coma, and death. It doesn't get much clearer than that. And it's not just opioids. The exact same deadly risk applies to alcohol. See, both substances are central nervous system depressants. When you combine them, you're creating this synergistic effect that can just overwhelm the part of your brain that controls your breathing. You're basically telling your body to stop breathing. The result can be, and sadly too often is, fatal. So, this all leads us to our final section, which is really about the bottom line, the absolute must-know safety warnings for anyone who is prescribed this medication. A really critical warning here is for older adults. The elderly are just far more sensitive to lorazepam's effects. This means there's a much higher risk of severe confusion, dizziness, and unsteadiness, which can directly lead to devastating falls and broken bones. For this group, the risks can very easily outweigh the benefits. So let's be perfectly clear about the rules for using this safely. Number 1, it is for short-term use only. Number 2, you have to follow the prescription exactly, never take more. 3, avoid all alcohol. 4, do not drive or operate machinery. And finally, and this is so important, never ever stop taking it abruptly. You have to discontinue under a doctor's supervision with a slow, gradual taper. These rules are completely non-negotiable. And for anyone who is pregnant or breastfeeding, the warning is just as serious. The medication is generally not recommended at all because it can cross the placenta and get into breast milk, posing really serious risks to the baby. We're talking about things like birth defects, or causing the newborn to suffer from sedation and even withdrawal symptoms. And so we end right back where we started. Lorazepam is an incredibly powerful tool, and it's amazingly effective in a crisis. But it's a tool that demands an equal amount of respect for the risks it carries. It really highlights a fundamental challenge in modern medicine, and it leaves us with a pretty critical question. As patients and as doctors, navigating a world of these powerful pharmaceuticals, how do we best balance these profound benefits against such profound risks?